Imagine this for a second. You're a federal employee, you get injured on the job, and you think, okay, there's a workers' comp system, I should be covered.
Right. You expect some support.
Exactly. Only. You discover you actually can't find a doctor, not one who will treat you. And this isn't hypothetical. In places like Kansas City, St. Louis, right here in Missouri, this is the reality for injured federal workers.
Postal carriers, VA nurses.
TSA officers, yeah. People are reporting calling literally dozens of clinics, just trying to find one provider.
Right.
Well, it's pretty dire.
It really is a shocking gap in care.
Okay, so let's unpack this today. We're doing a deep dive into this critical but honestly often overlooked access to care issue for federal employees here in Missouri.
The shortage of doctors willing to take federal workers' comp cases. OWCP claims.
That's the one. We'll explore why this shortage exists, what it means for people, and this is where it gets really interesting, we'll look at a unique solution that seems to be making a profound difference.
And you know what's fascinating is you said this isn't just a little local hiccup in Missouri. It's actually a nationwide issue.
Oh, really?
Yeah, there's a serious lack across the country of qualified physicians who are actually trained in OWCP and willing to take these cases. You see, many doctors might advertise federal workers' comp friendly.
Right, I've seen that.
But as the real experts in this field will tell you, most of them, frankly, have no clue how to navigate the incredibly complex federal injury claim process. It's very specific.
Well, wow.
And the result? It leaves a staggering number of injured federal employees. One estimate puts it at 97%, either paying out of pocket.
97%.
That's the estimate. Paying out of pocket or maybe using their personal health insurance, using up their sick leave.
Instead of the system that's supposed to be there for them.
Exactly. Instead of getting their legitimate work injury claims actually accepted and paid for by OWCP, the Office of Workers' Compensation Programs.
Which is exactly why this deep dive feels so important right now. We're going to walk you through the specific reasons this scarcity exists, the real frustrations workers face.
The consequences, yeah.
And then introduce this beacon of hope, really, in what's been a pretty challenging landscape. We want to make sure you walk away with some concrete, actionable knowledge on this.
Sounds good.
So to really get a handle on the scale of this, let's talk about just how bad the shortage is, particularly here in the Midwest. You mentioned Kansas City, St. Louis.
Yeah, for a long time, injured federal workers there really struggled. I mean, it was a dire situation.
How dire?
We're talking about people, federal employees, hurt on the job, literally having to drive over 100 miles just to find care.
100 miles just
Yeah.
for a doctor's appointment.
Because finding local orthopedic specialists or neurosurgeons who actually knew OWCP and would take the cases, virtually non-existent.
Think about that. You're a postal worker, maybe a nurse at the VA, a TSA officer.
Yeah.
You get hurt serving the public.
And you can't get timely local treatment. It's a major problem.
So that begs the question. Why? Why do so many private doctors just say no to these OWCP cases?
Well, the sources we looked at point to a few key things. First off, it's the sheer complexity of the paperwork and the claims process itself.
Oh, the bureaucracy.
Exactly.
Yeah.
Treating a federal worker's injury isn't just, swipe an insurance card and send a bill. The Department of Labor, they require these incredibly detailed causation reports.
Causation reports.
Yeah, explaining exactly how the job caused the injury. Plus specific forms like the CA1 for the initial injury report, CA17s for progress updates.
Okay.
And just ongoing meticulous documentation that, frankly, many providers find overwhelming. It's really burdensome.
So it's time-consuming.
Very. One surgeon was quoted saying the requirements are so intense, busy doctors just generally decline to do it.
Okay, so it's not just about the medicine, it's this whole administrative maze they have to navigate?
Precisely. And then there's the financial side, which adds another layer of challenge.
Money always plays a part, doesn't it?
It does. Doctors are often hesitant because payment can be delayed or even uncertain. OWCP isn't like regular health insurance.
How so?
It has its own unique fee schedule, its own approval process. Providers actually have to enroll directly with the Department of Labor, and many just won't risk treating a patient if the claim might get denied down the road.
Because OWCP won't pay if the condition isn't officially accepted, right?
Exactly. So doctors are wary. They don't want to put in potentially months of work only to find out the bill won't be covered unless there's some guarantee up front.
That makes sense from their perspective, I suppose. A huge disincentive.
It really is. And even when OWCP does pay, Sometimes the rates are lower than what doctors get from other insurance or even Medicare.
Oh, interesting. So the fee schedule isn't as generous.
Often no. So when you combine that potentially lower payment with all the extra paperwork and administrative effort,
Some practices just decide it's not worth it.
that's the phrase you hear. It's simply easier for them to fill their schedules with, well, other patients.
Okay, so complex paperwork, payment issues. What else?
Just general unfamiliarity, honestly.
Mm.
Federal workers' comp is a very niche field. It's not something most doctors learn about in medical school.
Right.
So without specific training, a doctor might completely unintentionally leave out some critical detail in their medical report.
And that could sink the whole claim.
It absolutely can. It can lead directly to a claim denial by OWCP.
Wow. And I think we also saw mentions of employer pressure and maybe bad past experiences.
Yeah, those create barriers too. Sometimes injured federal workers are initially sent to these occupational medicine clinics.
The ones that have contracts with the agency.
Right. And sometimes, not always, but sometimes, those clinics might tend to, let's say, minimize injuries or resist referring out to specialists, maybe to keep the agency's costs down.
Okay, I see.
So then when the worker tries to exercise their right to choose their own independent OWCP doctor,
They find hardly anyone available.
exactly. And add to that, if a private doctor did try handling OWCP cases in the past and had a bad experience, maybe rejected bills, endless phone calls, just tedious communications.
They might just say, never again.
Precisely. They opt out entirely and refuse to take any new federal patients. It's a compounding problem.
So the bottom line for the person who's actually injured, it's this massive access to care crisis.
Absolutely. You have injured letter carriers, like you mentioned, calling clinic after clinic in Kansas City or St. Louis and just getting nowhere.
Just dead ends.
Or people having to put off needed surgeries for months.
Yeah.
Or, like we said, driving hours, sometimes even to other states, just to get treatment.
It's not just inconvenient. That sounds potentially dangerous.
It can be incredibly dangerous. Delaying treatment, that can lead to complications, maybe prolonged disability, or just not recovering fully.
And it makes that legal right you have under FECA, the Federal Employees Compensation Act, your right to choose your doctor.
It makes it pretty meaningless, doesn't it? If there are no doctors available for you to actually choose.
Okay, this all sounds pretty bleak. But this is where the story takes a bit of a hopeful turn, right? Because the situation in Missouri is apparently starting to change.
It is. There's this clinic, Restore Muscle and Joint, based near Kansas City.
Restore Muscle and Joint, okay.
And they've partnered with a clinic in St. Louis, too.
Yeah.
And they've really emerged as a desperately needed solution.
How so?
Our sources really highlight them as one of the very, very few clinics in the whole region that is dedicated entirely to handling these federal OWCP cases.
Entirely. That's their whole focus.
That's their focus. And what's really remarkable is the personal story behind it. The founder, a guy named Troy Pearson, he was actually a USPS letter carrier himself for 7 years.
No kidding. So he's lived this.
He's lived it. He saw firsthand the challenges, the frustrations that injured federal workers face dealing with OWCP. And that experience is exactly why he dedicated his career after leaving the Postal Service to advocating for them. He made it his mission to build a team that doesn't just understand the OWCP system inside and out, but that will genuinely put the injured worker first. Always.
And that commitment, how does it translate into practice? What do they do differently?
Well, it leads to a really unique, genuinely patient-first approach. Think about this. Most doctors, if you call with a federal injury, they'll tell you.
Your claim accepted first, then come back.
Exactly. Leaving you in limbo for weeks, maybe months, while you're hurt.
Yeah, that's the problem we just talked about.
Restore Muscle and Joint. Completely different. They'll see you right away as soon as you're injured.
Immediately, even before the claim is approved.
Immediately. They don't require OWCP claim approval first. From day zero, their doctors, who are DOL OWCP certified, by the way, they will evaluate your injury and start treating you even while the claim is still being processed.
That sounds like a complete game changer for someone who's just gotten hurt.
It really is. Their approach is comprehensive right from the start. They actually help initiate your OWCP claim for you.
They handle the paperwork.
They get it started. They do a thorough exam, obviously, and begin the right care immediately. Could be bracing, medication, pain management, physical therapy, whatever's needed.
Because early intervention is key.
Absolutely crucial for a good recovery. In fact, one of the very first things their staff does is help you file the right form, the CA1 for a traumatic injury, or a CA2 if it's an occupational disease type injury.
Okay.
And they notify your agency officially kicking off the OWCP claim process for you.
And they're willing to take on these new patients, start treatment, before OWCP gives the green light on the claim itself. How do they manage that financially? Isn't that the risk other doctors avoid?
That's the key question, isn't it? They have robust systems. They work hard to ensure the treatment actually gets paid for so the injured worker isn't stuck with bills.
Oh.
Well, for instance, if your injury was just reported, like very recently, Restore Muscle and Joint will immediately work with you to get a Form CA-16 from your federal employer.
Form CA-16. Okay, what's that?
The CA-16. It's often overlooked, but it's incredibly important. It stands for Authorization for Examination and/or Treatment.
Authorization. Sounds good.
It basically acts like a voucher for your medical care, specifically for the first 60 days after a traumatic injury, like a fall or a sudden strain.
Okay, first 60 days.
Right. And here's the critical part. If you request this form from your supervisor within 7 days of getting hurt,
Within a week.
your agency can issue it. And that form guarantees payment for your initial treatment. Things like doctor visits, maybe some basic diagnostics, physical therapy.
While OWCP is still figuring out the claim.
Exactly. It essentially pre-approves you to get care right away without waiting for the final OWCP decision. So Restore Muscle and Joints team, they make absolutely sure to secure that CA-16 whenever possible.
Covering that crucial early treatment period.
You got it. So
Yeah.
basically, at Restore Muscle and Joint, you get treated from day one, and they worry about handling the billing and the authorization.
That's huge. So it's not just the immediate medical care. It sounds like they manage the whole OWCP case, too.
Full case management, that's a big part of it. They have dedicated OWCP forms, specialists on staff. They're doctors. They live and breathe this stuff, the federal workers' comp paperwork.
They take that administrative burden off the patient.
Completely. They file the claim forms. They document your injury using the exact language and level of detail OWCP requires. They handle the communication with your employing agency, with the DOL.
Wow.
They really pride themselves on getting claims accepted, hopefully on the first try, by submitting these really complete evidence-backed reports.
Which has got to dramatically improve your odds of getting the claim approved.
Oh, absolutely.
Yeah.
Which is huge for your long-term benefits, your stability, everything.
And the medical services themselves, what do they offer?
It's pretty comprehensive.
Yeah.
They aim to be a true one-stop shop for injury care. So you get orthopedic evaluations, specialist referrals.
Okay, so they can send you to specialists if needed.
Yes, and they'll coordinate with those outside specialists. They'll even help bring one to their center sometimes. And crucially, they help that specialist navigate the OWCP billing system, which can be a hurdle.
Right, because other specialists might not want to deal with OWCP.
Exactly. And if, say, no local specialist will accept OWCP for a needed procedure, they'll discuss options with you. Maybe using your regular federal employee health benefits insurance first, and then getting OWCP reimbursement later.
Reimbursement, okay.
But even helping arrange travel to an OWCP-approved provider elsewhere, with OWCP potentially covering the travel costs. The main goal is always get you the care you need without delay, one way or another.
That's real advocacy. What about pain management and therapy?
Yep, they have that in-house too. Pain management services, medication management, injections to help keep you comfortable while the case resolves. And, true to their name, Restore Muscle and Joint, they offer comprehensive physical therapy and rehab.
Right in their clinic.
Right there. Licensed physical therapists help you get your strength and mobility back. And they make sure the therapy plan is fully justified and approved by OWCP for ongoing care.
And tests, like MRIs or X-rays.
They facilitate that promptly, too, making sure the orders are written in a way that OWCP clearly sees why the test is medically necessary for the work injury.
They seem to think of everything related to the OWCP process. What if something more serious is needed, like surgery?
Yeah, that's a big one. If surgery is required, Restore Muscle and Joint steps in to coordinate basically every aspect.
Like what?
Connecting you with surgeons who are willing to work with OWCP, or like I said, maybe bringing one to their federal injury center on a consulting basis. They handle getting the mandatory OWCP pre-authorization for the surgery.
Which is essential, right?
Absolutely mandatory. They sort out the surgeon's billing. And again, if finding a local surgeon who takes OWCP proves impossible,
They help you use your regular federal insurance.
they'll help you explore using your federal employee health benefits, your FEHB plan, to get the surgery done. And then, crucially, they help you file for full reimbursement from OWCP once your claim is accepted.
That sounds complicated.
It is. Filing those OWCP 915 reimbursement forms, attaching every single receipt and medical record correctly. It requires a lot of hand-holding. Most providers simply would never do that level of administrative support.
Okay, so their support clearly goes way beyond just the initial injury.
Oh, far beyond. Restore Muscle and Joint keeps following your case for as long as it's open with OWCP.
So follow-up care.
Regular follow-up exams, yes. Providing all the periodic medical reports that OWCP requires to keep authorizing your treatment and benefits. They'll also help with wage loss claims if you off work and need compensation. That involves filing a Form CA-7.
Another form.
Another form. They make sure those get filed correctly and on time. Essentially, they stay your partner through the entire recovery journey.
Until you're back to work, or you've received all the benefits you're entitled to.
Exactly. Patients aren't just left hanging trying to figure out OWCP's ongoing rules and requirements. Restore staff stays on top of all that.
It really does sound like that seamless one-stop solution they talk about.
That's the goal. You're not juggling calls between your doctor, a separate physical therapist, your agency's injury comp office. Restore Muscle and Joint aims to handle it all.
As they put it, we make sure your paperwork is correct, your claim is accepted, and your treatments from therapy to surgery are approved and paid for.
That sums it up pretty well.
So, thinking back to where we started, for years, federal employees in Kansas City and St. Louis, injured on the job, they felt, well, truly abandoned. Nowhere to turn.
A really difficult spot to be in.
But this deep dive really shows that era, thankfully, is finally starting to change, at least in this region. Restore Muscle and Joint, it seems, has become this trusted lifeline.
Making it possible for injured workers to actually get the full treatment and the benefits they're entitled to without having to leave town or fight tooth and nail for every little thing.
It represents quite a shift, doesn't it?
It really does. And it comes back to that philosophy you mentioned earlier.
Yeah.
The clinic's team, their allegiance isn't to the Postal Service's budget or any federal agency's agenda.
Their loyalty is where?
Only to the patient. Their goal is simple. Get the injured worker well, physically, and get their claim accepted and paid fairly by OWCP.
That must feel like such a breath of fresh air, especially compared to maybe experiences people have had with traditional company doctors.
Exactly. Those situations where maybe the focus feels more like getting you back to work as fast as possible, maybe even prematurely. This is different. It's patient advocacy.
So the key takeaway then, if you're a federal worker listening to this, know that you're not alone in these struggles. And at least in Missouri now, you might not have to travel 100 miles or fight this battle completely by yourself anymore.
Right. This clinic, Restore Muscle and Joint, is presented as a premier OWCP provider. And really, one of the few of its kinds nationally that's on this mission to educate federal employees about their rights and options.
And we really have to hammer home the importance of that CA-16 form again, don't we?
Absolutely. It is your gateway, your immediate key to getting authorized medical care right after a traumatic injury.
So remember, ask your supervisor for that CA-16 form within 7 days of the injury.
Don't delay on that. It truly ensures payment for that critical initial treatment while everything else gets sorted out.
Okay. So as we wrap up, what's the final thought here?
Well, I think this story about Restore Muscle and Joint, it's more than just about one clinic, isn't it?
How so?
It's really a powerful demonstration of how specialized expertise, when combined with real dedication, can actually address these pretty significant systemic gaps and truly advocate for individuals caught in the middle. It kind of reminds us that your legal right, like the right under FECA to choose your own doctor, well, that right is only truly meaningful if there's actually someone willing and importantly able to step up and navigate these incredibly complex systems with you on your behalf.
Makes you think, doesn't it?
It does. It makes you wonder, where else? Where else in healthcare or maybe other complex bureaucratic systems are people's fundamental rights kind of undermined not by law, but by sheer administrative complexity?
And what does that mean for solutions?
Yeah, what models of dedicated specialized support like this are really needed to truly empower individuals and make those rights a reality? It's an important question to consider.